So during menopause, we often see this change as far as an increase in cholesterol, notably LDL cholesterol during the menopause transition and after. We also see higher blood pressures in women as they transition through menopause and after menopause, and unfortunately, increase in weight, especially in the central adiposity burden. However, when we think about cardiovascular risk in menopause, it's important for us to know the risk factors leading up to menopause and regularly monitoring blood pressure, cholesterol, supporting and maintaining lifestyle changes. For those upward trends of uncontrolled blood pressure, higher LDL cholesterol levels, we recommend individualizing adding medication therapy also, but really understanding the risk factors of that particular woman. When we talk about cardiovascular risk assessment in women, there are multiple tools we have, such as the PREVENT risk equation from the American Heart Association, checking a lipoprotein A or LP(a), doing a coronary artery calcium scan if appropriate. So we have multiple tools to help us understand as far as the risk in women. We want to make sure that we're not just following the lab, we're actually treating and lowering blood pressure, cholesterol, and blood sugar to lower risk of cardiovascular events.